we want to take care of our smile. It's the only one we got. So registered dental hygienist from Dental-XsmileCentres, Anaida Deti is here to help us do just that. So we're dealing with, you'd think, in this day and age, we wouldn't have to deal with things like periodontal disease. Exactly. But we do, and what you do when you're young matters when you're older. I'm finding this out now.
For sure. Because
I'm dealing with stuff in my jaw that is thanks to bad habits when I was a kid. So,
absolutely.
What is periodontal disease and how do we avoid it?
Periodontal disease is actually one of the most common diseases out there, and that's the scary part, because you would think that everybody should know about it. But the thing is that the most common signs of it are usually bleeding gums, usually like when you have like puffy gums, or when they bleed when you brush and floss. So usually are the most common ones. And
why do they bleed? Even if you brush your teeth every day, why would your gums bleed?
The gums bleed because the plaque, sometimes you cannot remove it and it goes underneath your gums. So that's the only way to remove that plaque is by professional dental cleaning. And that's why usually you have to go to a dental hygienist or dentist so often. So that's very important.
They've got me on a 4-month schedule right now trying to deal with these issues.
And usually, especially when you do a lot of public speaking, that's usually very common that you need a little bit more maintenance.
Is that right? So teachers would have that issue as well?
Teachers, for sure. People that do public speaking, for sure. So it's very important to have a certain schedule. So that's why it's good. So I think 4 months recall, it's a good thing. It's a good thing.
Gingivitis, is that a periodontal type of disease?
That's actually the first step, but with gingivitis is actually that can be reversed. So with good oral care at home especially, and with professional dental cleaning, it's usually you can reverse it to healthy.
There you go. Those look like healthy teeth, am I right?
For sure. Yeah.
Was that the person we saw in the previous one?
Oh, I didn't see it. So this was actually.
Yeah, that looks comfortable. Is that the same person?
That's the same person, but it's actually the picture is upside down.
Oh.
So that's why. But
I thought it was just from your point of view.
That's actually one of my clients. So that's actually, she had whitening done.
Oh, cool. We'll talk about that.
Yeah. So she had some.
Laser treatment. What is laser treatment?
Laser treatment is actually one of the newest things out there, and laser treatments are used for periodontal treatment.
Really?
For sure. They are used for whitening. They are used for gum corrections. Laser treatment is very common out there nowadays.
Is it a hot laser, cold laser? How does it work?
It's through optical fibers. It's the most the thing that I really like the most about laser treatments for periodontal disease is actually it doesn't hurt. So that's probably one of the very important things. So that's actually one. It's called PerioWave, and it's through optical fibers that it just goes underneath your gums. And it actually kills the harmful bacteria, and it leaves the healthy bacteria there. So that's also one of the good things about it.
And then all you'd have to do is go in and flush it away, as opposed to scraping it away. Look at the difference.
So yeah, exactly.
Are you kidding me?
Exactly. So that's just before, so that's on the left side. And on the right side, you have just 2 days after. And that's also with professional cleaning, with scaling and root planing.
Oh, my.
So that's actually very, very nice.
It looks to me like that person needed surgery, but the laser took care of it.
It does, for sure. It does.
Holy mackerel. Okay, sign me up for that.
For that.
And now, whitening. Oh,
whitening.
We all want to have white teeth. What does it involve?
Actually, whitenings nowadays are very different from what they used to be. Because before, a lot of people used to get a lot of sensitivity, and that's usually when clients used to come in the chair, the worst thing it was the sensitivity after the whitening, or sometimes even during it.
Yeah, forget trying to have a coffee or a cold drink.
For sure. It was really bad. And sometimes, I even say after you have the whitening, especially in the cold weather, when you go outside, I usually say do not smile, do not open your mouth, because it's actually the cold air, it makes them a little sensitive. But nowadays with actually the whitening treatments that are out there is not as much sensitivity, and we also have different treatments that you do after.
What's the blue stuff?
That actually covers the gum.
Okay, protects the gums.
Protects the gum during the whitening, so they don't get burned.
And then you just blast away at the teeth.
Exactly.
Is it harmful?
It's actually not harmful. whitening treatments, they are not harmful whatsoever.
Looks good though.
Yeah, they look
And that's
good.
a natural white. Sorry to interrupt you.
Natural.
That's a natural looking
For
white
sure.
as opposed to the blue white that you see.
Exactly. Because sometimes, you know, you want, we usually say the teeth have to match the white part of your eye. So if they are actually whiter, it's actually not natural. So
Then it
that's
makes you look bloodshot too.
Exactly.
It's interesting.
Especially if you're a little tanned, that actually looks not so natural.
No.
For sure. So
would you literally be looking at someone's eyes and thinking, okay, yep, we should stop now?
Usually it's a certain, like the way you do the whitening, it's usually done a certain time. So sometimes people, I usually say, you know what, I think this is probably, you know, very natural for you, so I don't think you should do it for a certain period of time. So it doesn't get any whiter than this.
Gotcha.
For sure.
And those treatments take place in the office?
In the office.
How long does a treatment take?
I usually do them for about 20 minutes, 2 treatments. 20 minutes each. I usually, if there is no sensitivity or if the person is a smoker or sometimes if they have bad habits, I usually leave it a little bit longer. For people that usually have a white smile to start with, it's usually even 15 minutes is usually good. I'm a big fan of in-office whitening because there I can actually control it.
Right.
When you tell people what to do at home with the take-home whitening, it's a little bit different because you don't really know exactly what they are doing.
And then how often do you have to come back and redo it?
Usually I say not probably for a year or so.
Oh, that's all right.
It's quite nice, for sure.
Thank you so much.
No problem, thank you.
Great stuff. If you want more information, Dental-XsmileCentres.com. When we come back, helping make sense of nutrition labels. I'm going to be put to the test, I think.